In the name of God, in this session, I want to talk about the vascular system development. As you remember in last session, during the development of the heart tubes, in the upper end of the future heart tubes, some arteries are developed as a result of the angiogenesis and vasculogenesis. Here is a vascular arterial end of the heart tubes. As you know, here the last chamber or uppermost chamber in the heart, its name is bulbus cordis, and I divided the bulbus cordis to three parts. The wanted upper part of the bulbus cordis, its name is truncus arteriosus. And as you know that during the formation of the heart tubes, two septum is formed in here, conotruncal septum, right and left, and I divided this part in right and left side, and the one-third upper means that truncus arteriosus in the left side making the vestibule of aorta, and the right side making the infundibulum. It means that outflow of the right and left ventricles. The uppermost part of the truncus arteriosus, its name is a aortic sac. It means that this aortic sac is uppermost part of the truncus arteriosus. Now I draw this part again in here. This is a truncus arteriosus, and the uppermost, as I told, is aortic sac. The aortic sac has two limb or two horn, right and left, and from here some aortic arc is formed, right and left aortic arc are forming here. This is the first aortic arc. The second one, the third one, the fourth, and the sixth. And again in the right side, the same arcs are formed. Like our left sides. Finally, you see that the first, second, the third, fourth, and sixth. The fifth never is formed, but I don't write the name of the number of the 5. In the right side again, the number of the arc are formed here. And this is aortic sac. You can see that each arc has a communication with the aortic sac. And this is a left dorsal aorta. And this side is a right dorsal aorta. And you can see that after this short distance joining the right and dorsal aorta, and here we have one dorsal aorta here. And attention please that the heart are situated in front of the dorsal aorta. This is a two-dimensional pictures, and you can see in the anterior view. But if you look at the heart in the lateral side, you can see that here it is a lateral side view. This is a first, second, until to the sixth. Here is anterior and here is a posterior. It means that the heart situated in front of the dorsal aorta. In lateral side, this relation is understanding very well, but if you look at in an anterior view, the both of them situated in the same levels. This is a important point. After the short time, we have a remodeling this artery arcs, because in our body we don't have this position between, or this relation between the heart and the aorta. In the normal anatomy, if you look at the relation between the aorta and heart, we have these pictures like this one. And this one is a pulmonary artery, pulmonary trunks, the right. This is a pulmonary, the right and left pulmonary artery, and this one is a ligamentum arteriosum. And here we have a right to left, the branch of aorta, the left subclavian, left common carotid, right common carotid, right subclavian, and this one is a brachiocephalic. Okay, now I want to change this map, this aortic arc map, to these pictures. Okay, here the first arc, the most part of the first arc are degenerated and making a small part of the maxillary artery. I'll draw one tables, one arc, second, third, fourth, and sixth. This is the right side and left side. The first arc degenerated and in the both sides making a small part of the maxillary artery, maxillary artery, maxillary artery. In the second arc again are degenerated and making two temporary artery. One of them is stapedial artery and hyoid artery, stapedial and hyoid. The both artery is developed from the second arc, but after the short time they are degenerated. In our body we don't have any stapedial because that artery is remain till to the development of the internal air ossicles, and after the formation and development of the air ossicles, stapedial bone in the inner air, the artery is degenerated, but during the embryonic period these arteries are important. The second one is finished, but about the third one in our body making the common carotid artery in the both side and proximal part of the internal carotid artery. Here is common carotid and here is proximal part of internal carotid, because as you know this is a arc of aorta, This is a common carotid. Left and right, after the short time, we have an external and internal in both sides. This is the internal carotid, and this one is the external carotid. Okay? Here, if you look at the third arc, the third arc making a common carotids here. Common carotid in here, and proximal part of the internal carotid till here. The remaining part of the internal carotid, this part, is made by it means that the internal carotid part, the proximal part made by third arc, and distal part made by the dorsal aorta of the same sides. Okay? That side again, like the left side. You can see that the internal carotid artery made by third arc and right side of the dorsal aorta. But what about the external carotid artery? The external carotid artery is outgrowing from the third arc. This is outgrowing, this is an external carotid artery. This is a third arc and is clear, making the carotid systems by cooperation with the dorsal aorta. What about the fourth arc? The fourth arc has a different development in the right and left sides. What that means, if you imagine the embryo in the future neck, you can see that we have some intersegmental artery This is a intersegmental artery. Intersegmental arteries. We had 7 intersegmental artery in the both sides. I have to clean these pictures and I'll draw in here. In the both side. I draw again the aorta because this picture is important for the understanding of the fate map of this artery in here. You know the name of this artery, like that picture I clean from here and draw in here again. The fourth arc in the left side, making a small part of the arc of aorta in here. I write in here by the making the part of the arc of aorta between the left carotid and left side clavia, and this part of the arc of aorta. This part of the arc of aorta is made by left fourth arc. I write in here, this one in the left side, making a arc of aorta between left common carotid and left subclavian. These parts, the D parts, huh? Here making a common carotid and proximal of internal carotid. Like this, the same, but in the left side, the fourth arc making a part of the arc of aorta. And what about the left subclavian? The left subclavian is made by the left 7 intersegmental artery. And after the formation, these two arteries communicating together. This is a left subclavian, this one. It means that left subclavian is made by 7th left intersegmental artery. What about the right side? The right subclavian artery in the anatomy, here, the right subclavian artery has 3 origins. I write here the number 1, number 2, and number 3. The first part of the subclavian are made by right 4th aortic arc, the middle part made by the right dorsal aorta, and the distal part made by 7th right intersegmental artery. I write in here number 1, number 2, and number 3. It means that here the fourth arc made by in the right side make the distal part of the right subclavian. Only this part, proximal part, the proximal part. Only the proximal part of the right subclavian, it means that these parts, made by the fourth arc. The middle part is made by right dorsal aorta, and the distal part is made by right 7 intersegmental artery. What about another segmental artery? The one communicating artery connected these intersegmental artery and making one important artery that his name is vertebral artery. In the anatomy, the vertebral artery is one important branch of the subclavian in the right and the left. This is a vertebra. Again, this one is a vertebra. We say that the vertebral artery is a largest branch of subclavian artery in the both sides. The vertebral artery enter to the skull and supply the brainstem. And what about the 6th arc? The 6th arc, in the right side, the communication between the 6th arc and right dorsal aorta is degenerated. It means that distal part is degenerated, and making the right here, if you remember, here we have a pulmonary artery. This is a pulmonary artery, the pulmonary trunk. The 6th arc in the right side, the 6th arc, making a right pulmonary artery, and the left side again making a left pulmonary plus, what does it mean? It means that in the left side, the distal part is not degenerated. And we have a communication between the sixth arc and aorta. This one, we have a communications. This communication during the embryonic life, its name is ductus arteriosus. After the birth, this duct is degenerated and making a ligamentum arteriosum. Ligamentum arteriosum. You see that this ligaments in human anatomy, and in the left side, as I said, left pulmonary artery plus ductus arteriosus. Okay, as a result of this changing, it means that the degeneration of the distal part of the right arc, sixth arc, the vagus nerve, we have a vagus nerve in the right side and left side. As you know, the vagus nerve has a one branches, that name is recurrent laryngeal nerve. In the both sides, this branch is derived from the vagus. But when the distal part of the sixth arc in the right side is degenerated, the recurrent laryngeal nerves in the right side come up, and it's one branch of the vagus nerve in the neck. It means that this nerve arises from the vagus nerve in the neck, and we say that right recurrent laryngeal nerve is a branch of the vagus nerve in the neck, but in the left side, as a result of the remaining of the distal part of the sixth arc, the recurrent laryngeal nerve is a thoracic branch of the vagus. It means that it arises from the thorax region, recurrent laryngeal nerve. This is a one important point in the anatomy. And here, if you look at my picture, you can see that the pulmonary trunk and ascending aorta, it made by truncus arteriosus. The right and left pulmonary artery made by the sixth arc. The common carotid and proximal part of the internal carotid made by third arc. And the external carotid artery is branch of the third arc. The fourth arc in the left side making a part of the arc of aorta, in the right side making a proximal part of the right subclavian. But what about these parts? It means that the first part of the arc of aorta and the right brachiocephalic vein, artery, these two parts of remains, and all of the arc is finished, okay? What's the origin of this part? The first part of the arc of aorta and the brachiocephalic artery. As you remember, I told you that the aortic sac has two limbs or two horns. Some texts say that horn, right and left, because if you imagine the aortic sac is like this one, here and here, the right and left horn or limbs. The left limbs making the first part of the arc of aorta, it means that this part, and the right limbs making a brachiocephalic artery. Is it clear? The left limb of horn of the aortic sac making the first part of the aortic arc, and the right limbs, it means that here, making a brachiocephalic artery. After the development of this structure, the distal part of the right dorsal aorta, inferior to the subclavian artery, is degenerated normally. This is an important change of the development of the arcs, and only the left dorsal aorta is remain, and we have some changing in the position of the some artery, but totally this is important for the aortic arc development. Okay, now we look at some pictures about the development of the artery and some abnormality. Please attention to these slides, and if you know the more detail, you can study the Longman medical embryology. Okay, the picture show that the development of the heart tubes and the same time development of the artery and vein. As you remember in last session, I told you that in the same time that the heart is formed, in the same time we have a development in the artery and vein. The vein below the heart tubes and the artery up to the heart tubes. This is a yolk sac, the future head and the future tail of the embryo, and here is a placenta. This is aortic arcs formation, and you can see here the first, second, third, fourth and sixth aortic arc, and here this is aortic sac, the uppermost part of the truncus arteriosus. Here the real picture of the aortic sac and the relationship between the aortic sac. This is a right dorsal aorta, left dorsal aorta, and the dorsal aorta. You can see here the first, second, third, fifth is degenerated very soon, and this part, it means that fifth arc never making any artery in our body. The fourth, fifth, and sixth, this is the fifth. And you can say that the final development of the arc, the first and second degenerated in this picture, the third making the common carotids and the proximal part of the internal carotid. In here you cannot see the external carotid because, as I told you, the external is outgrowing from the third arc. The fourth arc making a distal part of the arc of aorta between the left common carotid and left subclavian, and the right side making the proximal part of the subclavian. The remaining part of the right subclavian is made by right dorsal aorta and seventh intersegmental artery. This is a seventh intersegmental artery, and after the development, the left subclavian move up and come close to the left common carotid. But before the complexion, this one is situated lower than the normal side of the anatomy. This is a final development, left subclavian. If you attention the left subclavian, before the final change, the subclavian situated lower than normal anatomical position, and after the more development, we have a shortness in this part, and this left subclavian artery come to up and near to the left common carotid artery. And here is a vagus nerve. As I told you that the distal part of the sixth aortic arc is degenerated. As a result, the recurrent laryngeal nerves is come up to the necks, but in the left side, the distal part is remain, and the left recurrent nerve is a branch of the thoracic vagus nerve. And here, after the birth, as I told you, the ductus arteriosus obliterated and making the ligamentum arteriosum. This is a final development, as I draw for you. they told about everything, and look at again the left recurrent laryngeal nerves, and you can see that the nerve remain in the place and hooks around the ligamentum arteriosum, but in the right side, the right recurrent laryngeal nerves hook around the subclavian artery in the neck. The remaining part of the sixth arc in the left making ductus arteriosus. After the birth, this one is obliterated and making the ligamentum arteriosum. And you know that this is a communication between the left pulmonary artery and inferior surface arc of aorta in the anatomy. In the right side, the distal part of the sixth arc is degenerated. This one is one of the most common abnormality in this region. That name is a coarctation of the aorta. Coarctation of aorta, and divided the two kind, the postduct and preduct. In here, the duct means ductus arteriosus. We have a narrowing before the duct. This is a preduct, and after the duct, its name is postduct. Was the main reason? The main reason is abnormality in intima layer in the aorta, and after this pathological change in the intima, we have a proliferation in the medial layer in the arc of aorta. As a result, we have obliteration and narrowings, and the postduct is more common than the preducts. And if you look at these patients, the upper limbs, because the upper limbs supplied by the subclavian and axillary artery, we have a normal pulsation, blood pressure in the radial artery. If you examine the radial pulse in the upper limb, is pressure in the upper limb, blood pressure is normal, but the lower limbs has a weak blood pressure because the obliteration take place in here. And if you examine the lower artery, lower limb artery, like a femoral artery, we have a low blood pulsation in the lower limb arteries. In this abnormality, you can see that the abnormal origin of the right subclavian artery, because you can see that the obliteration of the right fourth aortic arc and proximal portion of the right dorsal aorta, with a persistence of the distal portion of the right dorsal aorta. Because normally the vice versa, these parts remain and the distal part of the right dorsal aorta is obliterated. And here we have a vice versa, the proximal part is obliterated and degenerated, and distal part is remain. As a result, this abnormal right subclavian here crosses the midline behind the esophagus and maybe compress it, because this artery want to go to the right side, and here we have a dysphagia. Its problem in swallowing is dysphagia. This one is double aortic arc. You can see here the double aortic arc. This abnormality is formed as a result of persistence of the distal portion of the right dorsal aorta, because normally this distal part of the right dorsal aorta is obliterated. The double aortic arc forms a vascular ring around the trachea and esophagus. This one is obliteration of the fourth aortic arc on the right and left in the both sides. The fourth arc are degenerated. the persistence of distal portion of the right dorsal aorta. As a result, we have an interrupted aortic arc abnormality. The aorta supplies the head, this one. The aorta supplies the head, the pulmonary artery, by way of the ductus arteriosus, supply the rest of the body. Okay, that's all. This is a development of the artery. In the next part, I want to talk about the development of the vein. Okay, the development of the venous end of the vascular systems. As you know, the vein develops in the lower part of the heart in here, and we have one draining systems that in each side some vein drain to the sinus venosus in the right and left sides. You know that the name of the vein, I write again, this one is an anterior cardinal, the right. That one is a left. This one is a posterior cardinal. Again, the right. Here is common cardinal. The right common cardinal. This one is a right umbilical and right vitelline vein, and the opposite side again the same name. This is a sinus venosus, left horn and the right horn of the sinus venosus. The anterior cardinal vein drain the blood from the head and necks and upper limbs. The posterior cardinal vein drain the caudal part of the embryo. It means that lower limbs and abdomens. The umbilical vein bring the blood from the placenta, from the mothers, and the vitelline vein drain the yolk sac and the gut. As you know, in the body we have a cava systems. It means that superior vena cava and inferior vena cava, and hepatic systems, hepatic system vein that drain the GI tracts, and the azygous system that drain the body wall, especially the posterior intercostal veins. You read in the anatomy. And now I want to tell you one by one, the first of all about the superior vena cava. You know that here, the superior vena cava in anatomy this is a left brachiocephalic vein. This one is a right brachiocephalic vein. And this one is superior vena cava, and this one is a right arterioles. As you know, in each side, the right and left brachiocephalic, each of them, they drain the internal jugular that come from the head and neck, and the subclavian is come from the upper limbs. It means that each brachiocephalic vein is formed by joining two veins in each sides. I write only the left and the right again, the same of the left. And here the SVC in the gross anatomy is formed in the behind of the first right costal cartilage and drain to the right atrium opposite the third right costal cartilage. And now I want to tell you how this systems is formed. The superior vena cava, or this veins, are formed by right and left anterior cardinal vein. But how it forms? If I draw and make one communicating vein in here, this communicating vein is formed between the right and left anterior cardinal vein, and I degenerated the distal part of the anterior cardinal vein in the left side. As I told you in the last sessions, this part is obliterated, and if you imagine and compare these pictures with this one, the superior vena cava is forming here. The left brachiocephalic, this is a left brachiocephalic, the future left brachiocephalic. This vein is formed by this communicating vein between two anterior cardinals. The right brachiocephalic, this one, made by right anterior cardinal vein. The superior vena cava, it made by right anterior cardinal vein and right common cardinal vein, SVC. I write here the right anterior and right common cardinals. After the short time, we have one rotation here because our SVC is a right angles. Here we don't have a right, we have some changing in the position, and both sides come along to each others. This is a formation of SVC. Is it clear? Okay, about the hepatic systems and IVC. I told you about the IVC because the IVC formation is a complex process, I told you. But the hepatic system, as you know, the GI tract, blood that observed by GI tract, the first of all, this blood coming to the livers, and after the exchange between the hepatocytes, the nutrients like amino acids, fatty acids, and carbohydrate, it storage in the hepatocyte cells, and that blood that exists from the livers is drained to the IVC. This is the IVC that move behind the hepatic and behind the livers. This is the IVC, the green colors. This is the IVC that it's formed in the posterior abdominal wall by the right and left common iliac vein. The two common iliac, this is a left and that one is a right common iliac. This is the IVC. The IVC passed behind the livers and penetrated the diaphragms. For example, this is a diaphragm, and enter to the right atriums. It is draining here. For example, in these pictures. It means that the portal veins, hepatic system or portal vein is correct, portal system. This is a portal vein. The portal vein is formed by a splenic vein and superior mesenteric vein. And here the one branches inferior mesenteric artery, mesenteric vein, drain to the splenic. Okay, I want to talk about the portal systems that absorb the blood from the GI tract, and after the exchange metabolites with the hepatocyte, the bloods from the liver drain to the IVC by two hepatic veins. This is a hepatic vein. Okay, the portal system. If you draw a GI tract, a future guts in here, I draw the guts, for example, this is a 4 guts. You read in the GI tract developments that liver is developing here, is outgrowing from the 4 guts. For example, the red color is a liver. The liver is formed step by step. We have an increase in the size. Like my picture, this is a livers, expanded and increased and proliferated and merged by the vitelline and umbilical veins. Yes. Below the livers, the future livers, as you remember, this is a right and left vitelline vein in here. This is a gut. You remember, this is a vitelline. Here again we have a one communicating vein between the right and left vitelline. It means that one communicating vein is forming here. This is a left vitelline and this one is a right vitelline. And if you compare this picture with this one, you can see that the right vitelline vein in here, making a superior mesenteric vein and the portal vein, and this communicating vein making a splenic vein. I write here by C. Okay, and the inferior mesenteric vein is formed by the left vitelline vein, and we have again the same map in here: portal vein, superior mesenteric vein, splenic vein and inferior mesenteric vein. And after the short time, if you compare the inferior, we have a variation, maybe is draining here, maybe draining here. We have some change in the drainage of the inferior if you compare this one and this one. Okay, that part again is obliterated in here. If it's obliterated, this map exactly like the portal vein systems. And what about the livers and right vitelline vein? And the uppermost part of the vitelline vein is obliterated in these pictures. We have another vein in here, if you remember. This is a left umbilical, and this one is a right umbilical. The right umbilical vein is completely obliterated in here. The uppermost or upper part of the left umbilical vein up to liver is obliterated. Do you remember the obliteration and diminish in the size of the left horn? And I told you that we have a left to the right shunt. the time of the development of the sinus venous. And the liver is expanded, and here the blood from the mothers come to the embryo through the left umbilical vein. This is connected to the placenta, left umbilical vein, because the right is obliterated. And finally, in the placenta, we have only one vein. Left umbilical vein is remain till to the birth. But if you look at here, we have in obliteration, what's happened? Into the livers, the one communicating duct is formed between the remaining part of the right vitelline vein and left umbilical vein here. The one duct is formed in here. This communicating duct is formed into the liver, and the right vitelline vein up to liver is remain here. The blood from mothers come toward the hearts from this pathway. This communicating duct, his name is ductus venosus. It's remained till to the birth, and after the birth, this duct obliterated and umbilical vein is obliterated after the birth, because the placenta is shedding off. After the birth, the ductus venosus changed to the one ligament and making the one ligament ligamentum venosum. You read in the GI tract anatomy, and the umbilical vein, left umbilical vein, again after the birth, obliterated and making a round or tres ligament that extended from the posterior of the umbilicus to the inferior surface of the livers. We have this ligament in our body in the free border of the falciform ligaments. Okay? The final change in the umbilical vein, left umbilical vein, after the birth, his name is round ligaments, you read in the anatomy, and the remaining part or obliteration of the ductus venosus of the birth, his name is ligamentum venosum. And this suprahepatic part of the right vitelline vein, because as I told you, the infrahepatic part of the right vitelline vein making a portal vein, and superior mesenteric veins and upper part of the anterior cardinal vein, right anterior cardinal vein, making a supra or hepatic segment of IVC. This is IVC. If you compare in here, I write in here because the portal system is finished. I write in the IVC is a complex vein made by many sources. The one sources for the IVC is hepatic segment. The hepatic segment means that this part only, not the whole of the IVC, because the IVC started from the posterior abdominal vein around the L5. It's a long vein. Only the suprahepatic part is made by the right anterior vitelline, right vitelline vein. Right vitelline vein making a hepatic segment, or the last part of the IVC. What about the remaining part of the IVC? I clean this part, only I draw IVC. I clean the hepatic portal system. If I draw this vein, for simplified my pictures and my lectures, I clean these parts. It means that I clean the portal vein systems, the umbilical systems, and I want to show only that IVC and development of IVC. And the next picture, only I draw these two veins, the posterior cardinal vein, and for simplification, I clean this part. But at the same time, it's happened. This is a common cardinals, anterior cardinal veins. This is a posterior cardinal veins. This is a posterior cardinal, left and right. And this is the IVC in the normal anatomy. A drain to the right atriums. Here is diaphragms. Here is the levers. This is a liver. Here we have a two kidney. Right and left. We have a two veins, right renal and left renal veins. Two hepatic veins. As I told you, this is a common iliac, left, and this one is a right common iliac, and it's formed, the IVC is formed from the opposite of L5. Here this is a suprarenal glands, and I come back to the embryo. In the same time that the vein are forming here, the new vein is formed. As you remember, I draw this one is hepatic segment of IVC that made by the right vitelline vein. In the same time, some new vein are formed that the new vein system is formed. His name is subcardinal vein. These veins are outgrowing from the posterior cardinal vein. Here we have again anastomosing vein or communicating vein between them, right and left subcardinal, and the same time a new veins informs here. The new veins are formed here. That name is supracardinal vein. This is a left This one is a left, this one is a left. We have asymmetric, the same time the right. Okay, the last vein system are found, the sacrocardinal vein. A new vein are formed in the lower part. Again, here we have a communication. That new vein is sacrocardinal vein. Left. Between the right and left supracardinal vein, maybe we have a one or two communicating vein, is not important. Okay, now I repeat again. The new veins form from the posterior cardinal vein. In each side, the one subcardinal, one supracardinal, and one sacrocardinal. Usually, this veins in the both sides has a communicating or anastomosic vein that connected these veins together. Okay. The subcardinal veins, if you look at my pictures, in the right side, this is a right subcardinal. Okay, this is a right subcardinal vein. The connection between the right subcardinal vein with the posterior cardinal vein is obliterated. As a result, the subcardinal vein make a new communication with the right vitelline vein here. Making a new communications here. And when it's communicate with the right vitelline vein, it means with a future terminal part of IVC, this part of IVC, a second part of IVC, it means that here, subhepatic segment or renal segment of IVC is formed. We say that the second part is a renal segment of IVC made by right subcardinal vein. The right subcardinal vein. The communication between two subcardinal vein, this one, because the kidney is forming here and here. This is a kidney form. This communicating vein, this one, making this one. This is a left renal made by the communicating vein. Subcardinal communicating. The left subcardinal, the remaining of the left, making this veins. Left suprarenal vein and left gonadal vein. This is a gonadal vein. It means that this is a testis in the male or ovary. Because in anatomy, we have two gonadal tissue, ovary in the female or testis in the male. Each of them has a one vein that drains to the IVC. In the left side, the left gonadal, it means that left ovarian or left testicular, drain to the left renal and drain by left renal to IVC. But in the right side, the gonadal vein directly drain to the IVC. Right gonadal. If you imagine here, the suprarenal is forming here, the remaining part here is changed to the left suprarenal, and this one is changed to the left testicular or left ovarian. This is the IVC. The right renal vein is formed by the outgrowing from the right vitelline vein, right subcardinal veins. Okay, the first part of the IVC, it means that the origin of the IVC that's situated in the lumbar region of our body is here. Again, that according to Langman medical embryology, because some text has another opinion about these parts. Again, the right sacrocardinal vein lost the communication with a posterior cardinal vein and making a new connection with right subcardinal vein. This part making the IVC. It means that this part of the IVC, the last part, it's made by the right sacral region. This is the right sacrocardinal. It means that the IVC has 3 segments, the 1, the 2 and 3. Right vitelline, right subcardinal and right sacrocardinal. The communication between the 2 sacrocardinal vein here, this communication making a left common iliacs, and the remaining part of the right sacrocardinal making the right common iliac. Okay? This communicating vein between 2 sacrocardinal veins making the left common iliacs, the right sacrocardinal vein making the right common iliacs veins. Okay, what about the supracardinal vein? In summary, the supracardinal veins making a azygous systems. What does it mean? I have to clean the pictures here. I want to talk about the azygous systems. I come back to the anatomy. Do you remember that azygous systems, for example, this is a superior vena cava that's formed by a right and left brachiocephalic vein. This is a right arteriole, right brachiocephalic. This one is a SVC. Before drainage of the SVC to the right arterium, the SVC receive a one vein. This is an azygous vein. This is an azygous vein. Azygous. In anatomy, the azygous vein is formed in the posterior part of the abdomen by the ascending lumbar vein, and the subcostal vein. You read it in the anatomy. And receive the posterior intercostal vein. This number is, each of them is posterior intercostal veins. And finally, before the SVC entrance to the precardium, the drain by the arc of the azygos. In the left side, the first posterior intercostal drain directly to the left brachiocephalix. Second, third, and fourth drain by left superior intercostal vein. Again to the left brachiocephalic. The fifth, sixth, seventh, and eighth left posterior intercostal vein drained by the accessory hemiazygos. And the 9, 10, 11, and 12th drained by the hemiazygos vein. Okay, if you compare, this is a normal growth anatomy with these pictures. Look at the supracardinal vein systems. Here you can see the two communicating veins between the right and left supracardinal. This is a drainage of the accessory hemiazygos and hemiazygos. This one interrupted in here and making, it means that the left supracardinal vein making the accessory hemiazygos and hemiazygos, the right supracardinal vein making the azygos, except these parts, the arc of the azygos. This part is made by the terminal or this part of the posterior cardinal. It means that the azygos systems made by the right supracardinal, the arc of azygos made by right posterior cardinal. It means that the azygos system has two origins. Right, the most of the azygos made by right supracardinals. The remaining, the arc of the azygos made by posterior. The distal part of the posterior cardinal vein in the both sides is obliterated. The same part of the posterior cardinal, left posterior cardinal vein, making this vein, like an arc of azygos, making a left superior intercostal. In conclusion, the supracardinal systems making the most part of the azygos systems. Okay, look at some picture in here. We'll review together. This picture shows the development of the portal systems. But here is a liver buds. You can see that develop from the foreguts, the future intestines, the red colors. After the short time, you can see that this bud is larger and larger and merge and combined with the veins, and the vitelline veins making the sinusoids. A spatial vein in the liver, his name is a sinusoid. You read in the GI tracts, made by vitelline veins. And here, the communication between the right and left vitellines, here, making the portal system, as I draw for you. Finally, you can see here the superior mesenteric, portal vein, splenic, and inferior mesenteric before the formation. After the formation, you can see that the formation of the sinusoid, liver sinusoid, and finally drain of liver take place by two vitelline veins that form by left and right vitelline vein, and this one is a IVC. Here the yellow color is a supracardinal veins, finally making the azygous, hemiazygous, accessory hemiazygous. Sometimes we have a one communicating vein. It means that in gross anatomy, in the dissection room, maybe you can see that the azygous and hemiazygous drain only by common vein, and sometimes each of them separately drain. If we have a two communicating, the azygous vein drain separately from the hemiazygous vein, accessory from the hemiazygous. This one is a development of IVC. As I told you, IVC developed from the three segment, hepatic segment from the right vitelline vein, the renal segment by right subcardinal vein, and the last part, sacrocardinal segment, formed by right sacrocardinal segment. Maybe sometimes we have some abnormality like this one is a double IVC, double inferior vena cava, at the lumbar level arising of persistent of left sacrocardinal vein, because the left one in here is obliterated. Usually if it's this part is remain, we have a double IVC. Absent of IVC, the lower half of the body drained by azygous vein. Only we have a hepatic segment, the renal and the sacrocardinal is not formed. As a result, the caudal part drained by the superior vena cava. Double SVC when the left anterior cardinal vein is remain. If this part is not obliterated in the left side, as you remember, this part of the left anterior cardinal vein is obliterated. If it's not obliterated, we have double IVC, like these pictures. And the last picture, you can see that the circulation of the blood in the embryo. Here is a left umbilical veins that bring the blood from the mother is come into the livers, and the blood pass through the ductus arteriosus to the IVC. Here we have a mixing with the oxygenated bloods. The first step for the mixing or mixes the bloods, oxygenated blood mixed with the deoxygenated blood in the livers, and when the blood come into the heart, here in the right atrium, again we have a mixed oxygenated, because this is a deoxygenated blood come from the head and neck. Again here we have a decrease in the oxygens in the bloods. This is a oval foramen. The most of the bloods come into the left side. Again we have a mix, the oxygenated bloods that form the lungs, and finally we have a pumping the bloods to the aorta, to the whole of the body. After the birth, this vein is obliterated, making the ligamentum tres. The ductus venosus again obliterated, making the ligamentum venosum. The oval foramen is obliterated and making the fossa ovalis, and the ligamentum arteriosum, the ductus arteriosus obliterated and making the ligamentum arteriosum. This is adults, the ligamentum arteriosum, closed foramen ovals, obliteration in the ligamentum venosum, and that's all. For more information, please study the cardiovascular system development in the Lungman Medical Embryology. Thank you. See you in the next session.